Welcome to the session on effective strategies for building long-term care systems in Asia and Pacific. My name is Wendy Walker, and I am the director in the Human and Social Development Sector Group at the Asian Development Bank and your moderator today. So we've heard a lot yesterday. We've heard a lot yesterday and today about the need to develop long-term care systems and services to help support and improve the quality of life for older persons and their families, relieve the burdens on health systems, and address gaps in access to social and health services. This session is going to explore the trends and challenges in developing comprehensive long-term care and support systems by looking at how countries in the region are moving forward, what challenges they're facing, and what successes they're achieving. On this slide, you'll see a quick overview of what we can consider to be basic building blocks of long-term care systems. Some of the key areas include governance and leadership, financing, service delivery, workforce, and information systems. I show it as it might be helpful as a basic framework for thinking through the examples that you'll be listening to over the course of the next hour. So we have a very wide range of speakers today and perspectives who will discuss approaches to strategic planning, governance and coordination, financing, and adequate workforce for long-term care and support. And these topics will be examined as key system elements which need to be addressed in order to ensure that accessible, affordable, quality, and sustainable care and support services are reaching those who most need them. So with that very quick introduction and framing of the session, I'd like to introduce our first speaker today. It is Madam Wan Pin. She's the Deputy Director at the Department of Program Development in the International Affairs of the China National Committee on Aging, the CNCA. She's going to begin with a 10-minute presentation. We have another presentation also from Indonesia, but the speaker hasn't arrived quite yet. As soon as she does, we'll add her to the program. So Wan Ping is currently the Deputy Director at CNCA, and she has worked in the Information Office of the Secretariat for more than 10 years, organizing and participating in a number of publicity projects which have helped to promote the awareness of respecting older persons in the society as a whole. She has paid attention to the liaison and cooperation among ministries and commissions, and this is a key function of the CNCA, related to aging and older persons and the future development of the aging industry. She is also currently responsible for the collection and development of data related to aging. So Wan Pin, I invite you to the podium to give your presentation and tell us and help to situate us with the Chinese system. Thank you.
I don't have the PPT. Okay. Ladies and gentlemen, friends, I would like to extend my sincere thanks to the conference organizers for providing us with this opportunity to exchange and learn from each other. I would like to introduce the development of community-based elderly care services in China. By the end of 2023, China's population aged 60 and above reached 297 million, accounting for 21.1% of the total. The population aged 65 and above reached 270 million, accounting for 15.4% of the total. China has entered a moderately aged society with a large elderly population, rapid aging, and a sharp increase in the demand for elderly care services. In July 2024, the third plenary session of the 12th CPC Central Committee made significant decisions and arrangements for actively addressing the challenges posed by population aging. The decision explicitly proposed to foster community-based elderly care service institutions. In recent years, China has explored in this regard. A series of policies and measures have been introduced from the central to local governments, and remarkable results have been achieved. Firstly, strengthening policy support. The government issued 11 policy documents on elderly care services, and various departments issued 90 policies, most of which deployed the development of home-based community elderly care services. Since 2016, China has selected 203 regions to carry out pilot projects for community-based elderly care services. Since 2021, China has allocated 4.5 billion yuan to support projects for improving community-based elderly care services. Secondly, enhancing community services for the elderly. China is actively promoting the development of community-based elderly care service institutions which operate on a chain basis with standardized management and is close to the community. By the end of 2022, China has 347 million community-based elderly care service institutions and facilities, with 3.111 million elderly care beds. Thirdly, upgrading the function of the primary medical and healthcare service network in providing services for older persons. Elderly-friendly service positions or windows have been opened in primary medical institutions. Green channels and barrier-free facilities have been set up for the elderly. More than 80% of community health service centers and township hospitals can provide long-term prescription services for 12 weeks. Firstly, organizing and guiding the participation of older persons in community governance services and mature elderly care services. China now has 19.1 million real-name registered elderly volunteers and more than 62 million elderly volunteer service organizations. Community service models such as neighborhood pairing, family and friend support, time banks, Metro Aid Society of Old Age Services, and Metro Aid Country Yard of Old Services are under exploration. Firstly, strengthening the construction of old age care services personnel, build career development pathways, construct a career development system for elderly care, and solve the problem of insufficient supply of elderly care service professionals. Scientific and reasonable plans for the development of the elderly care profession shall be formulated. Income increase so as to enhance the attractiveness of the elderly care profession. Sixthly, community-based cultural, sports, and educational services for older persons. Various parts of China have supported streets and communities in actively providing places for cultural and sports activities for older persons. The National Open University has set up more than 40 million learning points for education for older persons at the grassroots level. Actively addressing population aging is a long-term and arduous task. As the developing country with the largest elderly population in the world, China is looking forward to working with other countries in the world to jointly meet the challenges of population aging and create a better future for mankind. Thank you all.
Thank you very much, Wan Ping. That was a rapid overview of what has been an incredibly complex and also very evolving system development, quickly being run through the policy process and then actually trying to make changes to practice on the ground. So you gave us a good understanding of first the need, the urgent need for these services, and then some of the key policies that have been taking place, particularly since 2016, and looking through probably much driven by the different 5-year plans, how that is then transferred down to local level policy, and then what is actually happening in terms of practice across both the health and social care areas for home and community-based services. So highlighting the role of the primary medical and healthcare network, the development of elderly care services, the organization of older people actually on the ground and the services for them, and then the key issues around workforce and career development for people working within the sector. And finally, that broader space in terms of healthy aging, activities, and sports, etc. If I caught that correctly, that was really fast, but it shows how comprehensively the changes and the evolution of the system is beginning to emerge, really for this strong focus that the Chinese government has on the development of home and community-based services. So thank you. I don't think that our, oh sorry, please give your applause to Wan Pin. I don't think that our presenter from Indonesia, the Indonesia Deep Dive, has shown up yet. Okay. Okay, so we'll add her presentation towards the end. And in the meantime, I'd like to introduce these very experienced people up here on the panel. It's a wonderful panel Caitlin put together for sharing a number of different perspectives on developing home and community-based services on the ground and in the region. So the first person I'd like to introduce, I'll just introduce each one of you first and then we can get into the conversation, is Shintaro Nakamura. He is the Senior Advisor on Social Security at the Japan International Cooperation Agency, or many of you probably know it as JICA. He has been serving as the JICA Senior Advisor on Social Security since 2010, and he's been involved in a huge number of JICA projects on aging, social welfare, social insurance, and UHC, including the project on long-term care services for older adults in Thailand that many of you heard about yesterday, and the project on developing social security experts in Indonesia, and the projects on community care in Chile and Mexico. He also leads JICA's Knowledge Co-Creation Program on policies and practices in aging societies, creating age-inclusive community, which is organized annually, inviting officials of low and middle-income countries. And I think many people in the region have hopefully had a chance to join what is an excellent program that JICA has. The second person then is Caitlin Littleton. Caitlin is the portfolio lead for healthy aging at HelpAge International. She's worked there for the past 13 years and has focused first on the Asia-Pacific region and now globally leads HelpAge's work on health and care and support. She also leads HelpAge's Global Healthy Aging portfolio, which works with network members and stakeholders at all levels on advocacy, policy support, and programs in 3 areas of UHC, Fit for an Aging World, care and support, and community-based approaches to healthy aging. The last person on the panel is probably also well known to many of you, and if not, you should know her. Her name is Janice Chia, and she is the founder and managing director of Aging Asia Singapore. This is an organization that really helps us to keep a good pulse on the future of what's going to happen here. So Janice is the founder of Aging Asia, and influenced by the changing needs of her elders, Janice was inspired to start Aging Asia to drive and nurture opportunities in the development of innovation and solutions that address the evolving needs of the rising aging population in the region. She's accumulated a vast experience through many visits and the wide range of networking and events that she and her organization put together. And Janice has also launched several industry initiatives, including something called Aspire 55 Singapore, which is Asia's first virtual retirement village, and it's a well-being community that offers a combination of social health and care services, but also enables the members to continue to live in their existing homes. So you can see the different perspectives of Mr. Nakamura from JICA, Caitlin from HelpAge, Onpin from the government, and Janice from private sector. So now that that's laid out, let me try to start right away with Mr. Nakamura. JICA has played a very instrumental role in the technical partnership with many governments in the region on strengthening long-term care systems. I just referred to the big pivotal one in Thailand. It's often said that finance and workforce are the two system building blocks that are the most challenging to address. So reflecting on both the experience in Japan that you have and also from your work in the region, would you agree that these are the two most critical building blocks that really need to be addressed? And then what lessons are there in the ways in which governments have accelerated the implementation of long-term care systems and services?
Thank you very much, Wendy, for your great question. And I totally agree with your points that the financing and the workforce is the most difficult part of creating a new long-term care system. So I'd like to respond to your question in two parts. The first part is about comparing the Japanese experience and the Thai experiences in terms of their 2 points. So I compare both countries in their differences and their commonalities. And the second part of my response is about the key challenges and the ways to overcome these challenges. So let me start the first point. So when I compare the experiences in Japan and Thailand, their policy choices are different because their context, policy context, or their context on whatever is different. For example, as for the workforce, Japan promoted their private partnership with the private sector, including their for-profit enterprises, when we created their long-term care insurance program in the year 2000. So, and on the other hand, Thailand promoted their partnership with community health volunteers. And the background of these policy choices, in Japan, we had a long history of their partnership with private enterprises and both for-profit and non-profit. For the health services, from the start of the universal health coverage, the private health service provider played a major role in that. And also from the 1980s, the Japanese government actively promoted the outsourcing of long-term care services to the private sectors. And in Thailand, they have the 40-year history of their community village health volunteer program. So they trained them as a caregiver, and then they trained the nurses of the district hospitals as a care manager. So this is what happened in Japan and Thailand in terms of their workforce. And for the financing, Japanese government chose the insurance-based system because Japan already has had the social health insurance and also pension insurance. So they have already the administrative capacity to collect the premiums and paying the service fees or whatever. On the other hand, in Thailand, they created the long-term care program as a part of their universal health coverage system, which is their tax-based system to cover 3/4 of their total population, and so it was again the natural choice of their policy choice. So their policy choices were different, but they have many things in common. They are in approaching in creating a new system. And I think these commonalities are very relevant to the key challenges of the other countries, which is now promoting to create a new system of long-term care, and also it has some implications to the ways to overcome the key challenges. So, as a second part of my response, I would like to highlight 3 points. One is to reframe or to redefine the LTC, long-term care. In other words, both governments defined the long-term care as a social issue, not an issue of families only. So I think everybody here agrees that the long-term care is a social issue, right? But the general public doesn't necessarily agree on that. The other day, I visited Mexico, where the JICA is doing a project, and they organized the training for their family caregivers. And I talked with their people, their family caregivers who completed that training. And they said to me that before participating in that training, they were so isolated. They felt so isolated. So they just continue caring for their old parents or spouses, and without any acknowledgement or any recognition from the outside. But after joining that training, they felt that they were finally recognized or acknowledged by the society. They are supported. So their physical burden, of course, is very heavy, but emotional or mental, the burden of family caregivers are so huge. So I think the situation is more or less the same in the countries in this region as well. So in Japan, it was like a situation of 40 years ago or 30 years ago that we had a kind of same situation. So what the Japanese government did during that time was that they have the national dialogue initiated by the Ministry of the Health and Welfare. And that discussion, that national dialogue, not only the ministry people, but also the top-level politicians, both the ruling party and the opposition party, joined that dialogue. And it paved the way to the creation of the new long-term care system, which is the long-term care insurance. And on the ground at the same time, during the same time, the opinion leaders, they shared their situation of the family caregivers. Most of them were women, and they appealed. Their opinion leaders appealed for their new system or for their long-term care system, their social response to their long-term care. And in Thailand, in 2009, the National Health Assembly passed the resolution for creating a new long-term care system. The National Health Assembly in Thailand is a kind of forum of national dialogue on the issue of healthcare. So they organize a kind of national dialogue to change the perception of the general public. And second point is that let's leverage the existing systems to create a new system. So, as I said before, Japan, they utilize their already existing social insurance, the administrative structure, and also their capacity, and also their partnership with the private sector. And in Thailand, they utilize their village health volunteers as a human resources, and also for the financing scheme, they utilize the universal health care scheme. And the third point of the challenge, key challenge, is the sustainability and responsiveness to the changing environment. So what the Japanese government and Thai government did was to incorporate some mechanism to ensure that. So, for example, in Japan, the municipal government is required to make their plan on the long-term care for the older adults in every 3 years. And so every 3 years, they look at the situation of all the adults and their family caregivers, and then estimate the demand for the social care and also the long-term medical care, and then create their kind of plan. And based on that plan, their premium level is revised, most probably premium level raised to meet that necessary cost. And also in Thailand, the Ministry of Public Health, they incorporate the local government's initiative on their long-term care into their ministry's key performance index. So that ensures the sustainability of their local government's endeavor to extend their long-term care program. So these are the sharing from me. And let me add one point. I would like to propose to look at the bigger picture, which means that now Japan is promoting a community-based integrated care, which encompasses not only the formal services, but also the informal care. And in the context of that community-based integrated care, the private enterprises are very important actors. And in some areas in Japan, their local supermarket provide a shuttle service for the older adults, or maybe it can be, their customer can be the younger generation, but their supermarket do that kind of system, their services, so that older adults can come to their local supermarket and buy and enjoy shopping. And so for their older adults, in many cases, they have a difficulty in going out for shopping. And this is a kind of solution for that. And also, for their supermarket, they can attract their customers. So it is a kind of the win-win situation. And so we can look at that kind of the bigger picture to overcome the challenges. So that's all for me. Thank you from me. Thank you very much.
Thank you, Mr. Makamura. That was a wonderful, quick run-through, two really important examples from the region of Japan and Thailand, very different from each other. But I think you made it very clear that both systems built off of their assets and capabilities, the systems that they had, the administrative capacities, and the workforce that they had to be able to begin to expand and strengthen their systems. And secondly, that approaching the creation of the long-term care system also meant redefining what long-term care meant for both governments, and this very critical issue about reaching out and having a national dialogue. I think maybe in the questions we can come to that, because it's really about a kind of social contract about what is it that one expects, and what is really the role of government, the role of private sector, the role of NGOs and civil society, and the role of the family. And getting that clear helps the strategic planning a great deal. Finally, this really important message about sustainability and especially about sustainability being about more than just the specific programs, but really if you want to achieve community-based care, you truly need to think about the entire community and all the roles, such as the supermarkets. Yeah? Okay. Now I'll switch, thank you, that was an excellent overview. Now I'm going to switch over to Wang Pin, just to be able to discuss a little bit more many of the key issues that you raised in your overview. So over the last 15 years or so, China has been working very hard on developing its integrated long-term care system. It's come with some very clear strategic planning, lots of big ideas at the national level, lots of time and effort needed to filter it down to the ground. So could you share with our audience how China has, over the series of the 5-year development plans, that's really your strategic planning and the development planning process, social and economic development plans, move forward in developing the long-term care system, both in policy and implementation. What has been the focus in each one of those recent 5-year plans, and how have they added on to each other as the system has developed? What are the priorities? Also, finally, what are some of the big priorities going forward in this next 14th 5-year plan?
Thank you. The 13th 5-year plan for the development of national aging undertakings and the old age service system explicitly proposed to explore the establishment of a long-term care insurance system. Commercial insurance companies are encouraged to develop marketable long-term care insurance products and services to meet the diversified and multi-level long-term care needs of the elderly. The 14th 5-year plan for the development of national aging undertakings and old age service system further specified that a long-term care insurance system should be standardly established. The system will focus on addressing the basic care needs of people with severe incapacity. As Chinese population is aging, the long-term care insurance system is gradually moving from localized pilots to national promotion. In 2016, the government issued one policy document, and in this document, we launched a pilot of the long-term care insurance system in 15 cities. And in 2020, the government issued another policy document focusing on the establishment of independent insurance and ensuring the long-term sustainability of the system, and expanding the pilot program to 49 cities, from 15 to 49. By the end of 2023, data shows the number of insured persons had reached 180 million, with a cumulative total of 2.36 million dependent beneficiaries and a cumulative total of 72 billion yuan expenditure from the long-term care insurance fund. In the future, we will do the following things. First, the establishment of a long-term insurance system should be accelerated. The second is to strengthen the sellers' connection between the long-term care insurance system and the old age care service system. Thirdly, a comprehensive assessment system for the abilities of the elderly is to be established. Firstly, the reform of old age finance is to be steadily carried out. Yeah, that's all.
Okay, thank you very much. I think you're really outlining one of the most biggest pieces of the sustainability puzzle, the financing that has been being worked on. First as a pilot, the long-term care insurance pilot, starting very small in a number of cities, gradually expanding, gradually building up its coverage and also expenditure capacity. So that's a really big move in developing the overall system and actually linking and making it helping it to better link to both the health and the social care systems in the country. So now, Janice, I'll move over to you. Oh, wait, sorry, Caitlin, I'll move over to you. Caitlin, coming from an NGO, working itself through partnerships, it's always stated that successful long-term care systems and services are built on partnership. A partnership between national and local governments, the private sector, community, families, and CSOs. What do you see as the key roles that civil society can play in developing or strengthening long-term care systems? And do you see any especially important examples of that in the region?
Thanks, Wendy. Yeah, I was looking out at the audience to see who's here. And when the spotlights were on, it was really difficult. But I can see here that we have colleagues from Philippines and Fiji and Korea and Indonesia and Tonga and some from other regions as well. So I think I'm getting some waves. India, yes, okay. I like this. We have some UK in the back. So anyway, I was just thinking about which examples to share, because I think that what you've set up here with this conversation and who we have on the panel shows you sort of need to draw on everyone. And I think it kind of depends on the maturity of the long-term care system. So I would say that civil society is very diverse. You have like think tanks and research institutes, and you have who are technical experts leading on development of standards and advising governments. But you also have community-based organizations that are made up of members of the community who might not have a lot of technical knowledge, but have obviously the on-the-ground grassroots engagement and knowledge and experience of what the community, who is in the community, what they need. And then you have everything in between. And so when I think about that question, I think, you can look at some of the established long-term care systems in the country, in this region, like Singapore and Korea, where I think what happens is at the beginning you have families providing care and support, and when there are gaps, either because of not having family, or because family has moved, or because the complexity of the care required is more than a family can maintain, or there's other burdens going on that makes it difficult. It's often civil society, like faith-based organizations and NGOs and community-based organizations that are the first people trying to provide services in the community. And we heard in another presentation this week, I think it was maybe in a couple actually, the Indonesia side event was speaking about this, that one of the things that you see is that the acceptability of external service provision maybe happens first at that level. And we have seen that. I remember a study that was done in Vietnam that looked at communities that had intergenerational self-help clubs with volunteer-based provision. The acceptability of somebody coming to provide service was much higher. So I think there's a piece there. And I think that the other thing that you can see is exchange between countries coming from civil society who are meeting in networks or others and saying, okay, this is happening in this country, and that might be something useful here. So I was thinking of a pilot that HelpAge India did many years ago and has taken forward. But they were looking at what was being done in another country in terms of volunteer-based caregiving. And then they worked with the All Institute India of Medical Sciences and worked at that high technical level to identify how to adapt to the country, to the context, and then working with partners, elder self-help groups and senior citizens groups, and also the community-based organizations, to see how can we actually spread these models of care. And I think one story that's interesting about this is HelpAge Korea's story, because many of you would know that Korea has now got long-term care insurance and a mix of private, for-profit and non-for-profit providers. But at the beginning, that wasn't the case, and I think it was Mr. Cho's father, who's the founder of HelpAge Korea, was on a study visit in the UK and came back and had this idea of volunteer-based care. And then they developed that in Korea, and eventually there were 700 civil society providers of care before the long-term care insurance became something that people were thinking, okay, we should do this. And then Republic of Korea and ASEAN partnered on a 10-year volunteer-based home care project in all of the ASEAN countries. Of course, Singapore was also farther ahead. But in some places, like in Myanmar and in Philippines, you know, there was an idea of, okay, how could we take this forward? And in Vietnam, as I mentioned, you've seen that with the intergenerational self-help clubs being the largest provider of care services in Vietnam at the moment. So that's kind of those initial phases. But then once there's traction and the government, and with some support sometimes from, you know, development banks and international development partners like JICA, coming in and sharing experience, when the government decides to invest and develop, then the civil society can play different roles as well within that. Sometimes it's to be advocating for ensuring that older people themselves and the caregivers are included in the decision-making processes. They are also kind of sometimes calling out where there are gaps. You know, maybe there's something that's not being spoken about, like elder abuse in long-term care settings, or maybe there's a specific care service need that is not being considered because of stigmatization, either of disability, some types of disability, or age. And I think they often are the ones saying, this isn't okay. There are people falling through the gaps. We need to ensure that they're at the table. And then I think, you know, as I said, there's the Research Institute. So that's not a complete picture, but I think that there's sort of a role for civil society in many different ways, and that when you get to the stage where the government is investing and taking it forward, and you're looking at who is providing care, you start to see a mix of private and for-profit and non-profit providers with public funding or public provision. And I think there can be a role there. So I was interested to hear the Agency of Integrated Care Singapore showing a chart of how much of the care is currently provided by for-profit, non-for-profit, and public provision, and where the sources of financing are. But I would say to anyone here that is from a country that doesn't yet have a system that is kind of got a lot of coverage, that reaching out to, as you said also, village health volunteers, figuring out where the cadre are, is a good place of starting. But keep in mind the question about equity and equality. So make sure that you're, you know, I think a lot of the established systems have built off of unpaid, unrecognized labor from women and girls, especially those who are lower income quintiles. And I think that, you know, when you're developing your system, it would be zooming out, as you said. You want to zoom out and think about the whole of society, the impacts of who is providing care and who's receiving it. So I guess there's another whole set of civil society that are speaking about labor rights and women's work, but I think we can be part of that as well.
Great, thank you, Caitlin. That was a wonderful overview of really the various roles that civil society can take, and also the importance of the different types of investments that governments and others need to make in them to make them more effective. I think you raised, you know, you can draw on the capacity of civil society differently in different types of systems, that you really need to draw on the full range of capacities, both as experts but also as service provision and providers and a range of other things, advocacy. The importance of the networks for sharing, of the civil society networks for sharing experience. This is something that this region has a few that are really very strong, like HelpAge, like the Alliance for Asia, and others. But we really need to support them to be able to do that type of exchange, and also piloting and coming with new ideas. That they can be fertilized and developed and adapt. And this is really important as the systems grow and adapt. And that finally, as the government develops its systems, the roles of civil society can also change. And to that, I would also add as kind of monitoring mechanisms as well. So now, Janice, over to you in private sector. Private sector is playing an even larger role in developing long-term care systems and innovating new solutions, whether they be in terms of service models, use of technology, or expanding care. What do you see across the region in terms of the opportunities and challenges of private sector engagement in care services development and delivery? Where do you see innovation? What are you seeing coming around the corner in the future?
Right. Thank you. I think, first of all, the private sector plays an important role in many different industries and to drive economies. And the aging sector for the private sector could be uncharted territory. And in uncharted territories, one of the most important challenges to note is data. Should the private sector have to access their own data when engaging in innovation for the aging population, or would there be more opportunities where governments can come into play to share the data collected, whether it's the demographic data, the people living around, what is the data that the government already has that can be shared? And I think that comes down to conversations and more open dialogues between governments and private sector, and part of the national aging strategy for different countries to say, we, as part of our strategy, want to engage private sector to develop in innovations for the aging population, and we're willing to see where are the gaps there. And for example, if data is a gap, we will look at opening up some of the data points to share. Second, also I'd like to highlight for private sector is many private sector companies have always looked at different market opportunities, and children used to be one of the biggest market opportunities, and now it's moved to the older adult population. And as we can see from the advertising going around the world now, we are seeing more and more imagery of older persons inside there, and I think that's going to form a domino effect for the private sector to wake up to the opportunities. I say wake up because I think private sector is still a little bit slow, and because it's new and because it's difficult, sometimes they just want to go after the low-hanging fruit first, which is all the other age groups. And the aging profile is different because a person after the age of, I don't want to say 50, but 60, 70, 80, 90, but at different ages, it's not like the children market where we can say that certain ages you have certain development goals. But for older people, someone at age 60 could be more frail than somebody at age 95. And, so you can't really have very easily classified products across different age groups. And that's the challenges. And because of these uncharted territories and data and knowledge that has to be gathered, it helps a lot if there's more open sharing, even amongst the NGOs, governments, with the private sector, to look at all the research that's been done and all the positive case studies that's been done, or understanding the preferences of older people in each country. And actually from this event here, I've learned so much from the sharing, and I think more private sector companies could benefit from it. And immediately I thought of going back to share what I've learned from the insights of this event already, and just being part of the conversation here. So, and I think Aging Asia first started because we wanted private sector to be more involved in the conversations within government NGOs. And the other player that needs to be involved in the conversations is the media, because the way the media is depicting the aging population and the opportunities out there is affecting how companies think about the market sentiment. The way politicians speak in the media about different opportunities in the market affects how older people and companies think about the aging sector. So these all have impact. And regarding the private sector and the opportunities also, recently in Singapore, there was a huge article about aging taxi drivers in Singapore. And they are worried that with the advancement of driverless cars and new technologies and services like Grab, what is the role of the taxi drivers in future. And I think that already brings rise to a forum discussion where what is the evolution for that, and what is the role that these companies could play, perhaps, in creating that 1 kilometer village to make communities more accessible. The drivers could become a different service where they would be ferrying seniors during the off-peak hours to activities. I think there's a lot of innovations available for private sector to participate, and one thing we hope to draw from platforms like this today is how can we connect the dots and make sure that we have the correct repositories of data and knowledge that can be shared, and then creating more dialogues in future that has the government engaging with private sector. I think also from the government's perspective, long-term care systems, as they evolve, they can also help in terms of pricing strategies and form an advisory role on the pricing strategies. When we look at hospitals, for example, you know clearly what are the price of the surgeries and the treatments and the consulting hours. Everybody is clear how much it costs. But for aging services, sometimes we're not so clear how much it costs. And sometimes the manpower required to deliver aging services are not so simply put. And we can't just use technology to cover everything that aging services covers. And aging services is not just on care services. A lot is going to move towards social services, because it's really about how a person lives, play, work in that community. What are the services they need to continue working? What are the services they need to continue their social engagement? And these services don't have to be all medical services, as you've mentioned. And then the new economy for the silver economy is going to go around travel services, it's going to go along our wellness services, health longevity services. And I think these are different trends ahead that the private sector can help to contribute and even give ideas and innovations to more government dialogues and systems. Thank you.
Excellent, thank you. Well, what a whole other set of ideas to put on the table as well. I like the idea of the sharing of data between government and private sector to be able to help them to better target and develop services and functions within the overall system. And that you also link that to the development of these national strategies on aging, which is really the policy development that is leading the way forward and making the opportunities. So bringing in private sector into those discussions is also important. The private sector, the need for them to look at all of the opportunities, not just about the care services, but also about the larger market. And I mean, you said so many other things, but I think one final thing is really the important role that private sector can also play in terms of an advisory role or being a part of pricing committees or something to be able to push that information back and forth, and then thereby maybe help also to bring in some of the thinking more in terms of affordability, capacity, expansion of and coverage of a wider range of people as well by some of the private sector, which would help to fill some of the important gaps which have been developing quite remarkably in this region also by the engagement of private sector going for the really high market first. Okay, I think that we've just received our last speaker. Very happy to have you here. Let me introduce you quickly and then also give you about 10 minutes at the podium to make your presentation. We've just seen walk right on the stage Ms. Vencia Sitahang. She holds a Doctor of Philosophy in Management and Business from the Management and Science University, another Master in Epidemiology from FKM University of Indonesia, and a dental degree from the University of North Sumatra. But she's held various key roles in the field of health, including Director of Health for the Productive Age and Elderly since 2024. I think I would like to invite you to the podium to make your presentation, and I understand it will be a bit of a deep dive on the system in Indonesia.
Yeah, okay, thank you. I will present some presentation.
You have slides,
okay,
you can stand there. I think you're going to speak in Indonesian or English? In Bahasa. So just a minute then. Can we quickly make sure that people have the translation, including us?
Okay, good afternoon.
Just
Yeah,
2 minutes
okay.
so people can get the translation.
But I think the presentation will be in English. Oh, tidak ada yang bahasa Inggris kah? Ya, oke.
Okay, I understand that the slides are in English, so maybe we'll start and everybody can continue getting their headsets in the back, but you should be able to understand at least the beginning of this with the slides in English.
Okay, thank you. Good afternoon, ladies and gentlemen. Thank you for joining us in this room. I'm Fencia, Director of Health for the Productive Age and Elderly. I will share the health policy for the elderly in Indonesia. But I will convey it in Indonesian because you can hear that there is a translator here, I think, so that the language is more precise. And it is also our pride that Indonesian has been successfully established as the official language of the UNESCO General Conference on November 20, 2023 at UNESCO headquarters in Paris, France. Indonesia is the 10th language recognized as an official language of the UNESCO General Conference, in addition to 6 official languages of the UN. Baik, Bapak Ibu sekalian yang kami hormati, terima kasih. Slide-nya boleh berjalan. Ya, kami akan menyampaikan hal seperti ini. Tadi sebenarnya, apakah ini slide yang terakhir? Tadi slide-nya informasinya sudah ditranslate ke bahasa Inggris, begitu. Is this the latest version? I heard the presentation already changed to the English, but I speak in bahasa gitu. Oke. Mungkin Bapak Ibu sekalian bisa mendengarkan dengan translator ya, dengan alat translate. Bapak Ibu sekalian, bahwa berdasarkan data dari Biro Pusat Statistik yang ada di Indonesia tahun 2023, bahwa saat ini Indonesia telah memasuki struktur proporsi penduduk yang menua, dan di mana proporsi lansia Indonesia itu ada di atas 10%. Di atas 10% dari total jumlah penduduk. Persisnya itu adalah 11,75% tahun 2023, dan prediksinya diperkirakan pada tahun 2045 ini akan menjadi hampir 20%. Dan saat ini terdapat 8 provinsi paling tidak Indonesia yang memiliki proporsi lansianya di atas 10%. ada Yogyakarta, Jawa Timur, Jawa Tengah, Bali. Nah, Bali ini is a province that has a proportion of elderly people above 10% proporsinya dan above national proportion. Kemudian Sulawesi Utara, Sulawesi Selatan dan juga Jawa Barat dan juga Lampung. Bapak Ibu sekalian, seiring dengan proses penuaan ini, slide berikutnya, tentu terjadi penurunan daripada fungsi tubuh pada lansia dan peningkatan risiko penyakit. Itu sudah kita pahami bersama, dan hal ini tentunya akan menyebabkan menurunnya tingkat kemandirian pada lansia dan yang akan meningkatkan kebutuhan akan perawatan jangka panjang. Dan data riset kesehatan dasar yang dilakukan tahun 2018 terdapat 74,3% lansia di Indonesia memang yang masih bisa mandiri gitu ya. Bahkan 50% di antara mereka masih bekerja. Dan tapi ada 22% lansia yang sudah dengan tingkat ketergantungan ringan dan 3,7% lansianya ada ketergantungan sedang, berat dan juga sudah masuk ke total. Yang tentunya dengan meningkatnya jumlah lansia yang mempunyai permasalahan kesehatan akan menjadi beban daripada jaminan kesehatan nasional kita. Dan tadi kita lihat yang sudah ketergantungan sedang, berat dan total ini tentu membutuhkan perawatan jangka panjang. Saat ini JKN kita, lansia di JKN itu mendapatkan proporsi hampir 24% daripada total jaminan kesehatan nasional. Nah, slide berikutnya kita lihat ada undang-undang. Indonesia sudah punya namanya Undang-Undang Nomor 8 Tahun 2016. Di sana ada ragam daripada penyandang disabilitas. Tapi kita lihat definisi daripada penyandang disabilitas ini adalah setiap orang yang mengalami keterbatasan fisik, intelektual, mental dan juga sensorik dalam jangka waktu lama yang dalam berinteraksi dengan lingkungan dapat mengalami hambatan dan juga kesulitan untuk berpartisipasi secara penuh dan dengan efektif dengan warga negara lainnya berdasarkan dari kesamaan hak. Nah, 4 ragam ini tentu kita sama, barangkali ini juga adopsi dari global, ada fisik, intelektual, mental, kemudian sensorik dan juga ada yang ganda. Itu kemudian kita lihat lagi slide berikutnya adalah bagaimana strategi dan kebijakan di negara di Indonesia dengan permasalahan-permasalahan yang ada, dengan kondisi lansia yang nantinya akan menjadi banyak penurunan fungsi, kemudian akan menjadi ketergantungannya meningkat dan sebagainya. Apa kebutuhan yang harus kita penuhi sebagai pemerintah? Tentu kita juga sejalan dengan strategi global dan juga strategi dari regional dan juga ASEAN. Nah, bahkan saat ini ada kebijakan yang terbaru yang mengakomodir untuk kebutuhan lansia yang sudah diatur di dalam undang-undang. Undang-undang tentunya yang paling aturan yang paling tinggi ya. Nomor 17 tahun 2023 tentang kesehatan. Ini sangat baru sekali. Keluarnya di Agustus kemarin, dan ini adalah Omnibus Law yang memang kita fokus pada bagaimana kita memerankan keluarga. Jadi fokus daripada undang-undang ini kemarin adalah bagaimana peran keluarga itu ditingkatkan, peran masyarakat itu ditingkatkan, kemudian peran lintas sektor itu juga ditingkatkan, lalu tujuannya tentunya adalah untuk memberikan hak asasi manusia. Itu kekhasan daripada Undang-Undang 17 yang berbeda dari undang-undang sebelumnya di tahun-tahun sebelumnya. Kemudian diturunkan pada peraturan pemerintah nomor 28 sebagai terjemahan daripada Undang-Undang 17 tadi, yang tentunya juga akan diturunkan dengan untuk standar-standar pelayanannya. Jadi implementasinya seperti apa di lapangan akan diturunkan dalam peraturan Menteri Kesehatan. Dan saat ini memang ini kami juga baru mendiskusikan, makanya mohon maaf tadi naik ke atas juga agak terlambat karena memang ini ditunggu dan akan, karena pemerintah pemerintah Indonesia sebentar lagi ada perubahan pemerintahan baru, jadi semua aturan-aturan yang ada itu harus sudah selesai sekarang gitu ya. Tinggal hitungan hari pemerintah akan berganti, tapi kita semua berharap akan berjalan dengan baik. Kemudian ada juga peraturan Menteri Kesehatan nomor 6 tentang standar teknis pemenuhan standar pelayanan minimal yang harus dilakukan oleh sebuah wilayah, kabupaten, kota, dan puskesmas. Ini tentang lansianya seperti apa. Di sana sudah diatur bahwa setiap orang yang berusia di atas 60 tahun harus diberikan pelayanan dan targetnya harus 100%. Ini sudah menjadi bagian daripada kinerja, penilaian kinerja sebuah wilayah, kabupaten atau kota di satu provinsi. Kemudian juga sudah ada Juknis integrasi pelayanan kesehatan primer sebagai implementasi dari transformasi sistem kesehatan yang sedang dilakukan di Indonesia saat ini. Dan ada juga peraturan presiden, nah itu ini naik lagi ke atas, nomor 88 tentang strategi nasional kelanjut usiaan, di mana pada strategi yang kedua ini sangat jelas dinyatakan, diamanatkan untuk peningkatan derajat kesehatan dan kualitas hidup lansia dengan 4 indikator yang bisa mengukur secara akuntabel adalah meningkatnya status gizi dan pola hidup yang sehat, kemudian memperluas pelayanan kesehatan bagi lansia, menurunkan angka kesakitan lansia, memperluas cakupan perawatan jangka panjang bagi lansia. Nah, ini mudah-mudahan apa yang kita diskusikan di hari ini bisa sangat related gitu ya. Nah, berikutnya adalah program dari kesehatan lansia yang ada di Kementerian Kesehatan dari strategi dan kebijakan yang sudah diatur di dalam aturan-aturan ini. Nah, ya, ini adalah programnya, bahwa tujuannya tentunya adalah meningkatkan kualitas hidup daripada lansia tersebut, agar apa yang kita harapkan bahwa lansia itu harus sehat, harus mandiri, harus aktif, dan juga harus produktif atau smart, kita sampaikan, kita istilahkan itu, dan juga berdaya guna, jangan jadi beban gitu ya bagi keluarga dan juga masyarakat, tentunya dengan pendekatan siklus hidup. Jadi kita tidak mengurusin yang namanya setelah seseorang itu menjadi lansia, tapi bagaimana kita urusnya mulai dari bahkan jauh mundur, mulai dari calon pengantin. Semua masyarakat yang ada di Indonesia harus mendapatkan pelayanan sesuai dengan usianya. Jadi pendekatannya adalah siklus hidup. Seperti yang kita sudah sepakati juga di deklarasi, saya lupa, deklarasi yang adalah topiknya adalah people center. Kemudian tentunya tanpa menghilangkan, tanpa meninggalkan ketika lansia tersebut sudah sakit misalnya. Nah, tapi kalau dia belum sakit tentunya diberikan upaya-upaya promotif, preventif, kemudian kalau yang sakit tadi tentunya sampai kepada kuratif, rehabilitatif, bahkan paliatif dengan pelayanan yang santun. Apa bahasa Inggrisnya santun? Santun lansia di puskesmas. Nah, pelayanan geriatri juga dilakukan di rumah sakit karena puskesmas itu ada kompetensinya, ada batas kompetensinya. Ketika itu di luar kompetensi dari puskesmas tentunya harus dilakukan rujukan ke tingkat yang lebih tinggi, yaitu rumah sakit. Kemudian kita tadi sudah mendiskusikan juga perawatan jangka panjang bagi lansia yang membutuhkan, serta lansia pada situasi bencana. Bagaimana juga kita mengutamakan, mendahulukan pertolongan pada lansia ketika ada situasi bencana atau situasi krisis kesehatan dengan memberikan pelayanan minimum untuk kesehatan lansia. Itu sudah ada paketnya dan ada subklasternya untuk lansia dari klaster kesehatan. Nah, semua lansia dalam kondisi apapun diberikan pelayanan yang sesuai kebutuhan lansia, juga bagi lansia dengan penyakit yang terminal. Terminal diberikan pelayanan hingga akhir hayat lansia tetap bermartabat. Kami hadir di sini dari Indonesia tentunya dengan para guru besar dan juga para praktisi akademia yang ada di ruangan ini yang sudah punya pengalaman banyak hal. Di akademia juga ada Prof. Budi di belakang, itu juga sudah banyak memberikan dan juga melaksanakan, mempraktekkan berbagai hal bagaimana menuju lansia yang bermartabat ini. Nah, selanjutnya apa yang dilakukan untuk melakukan? Sorry? Oh, oke. Selanjutnya ada instrumen untuk screening sederhana yang digunakan ketika lansia, digunakan setiap pada lansia yang datang untuk pelayanan kesehatan. Itu dinamai dengan Skilas. Skilas ini, boleh lanjut slide-nya. Skilas ini tentunya merupakan screening awal dari ICOP yang memang ini sudah sangat sejalan, yang jika ditemukan penurunan kapasitas intrinsik pada lansia akan dilakukan pengkajian atau penilaian penuh oleh tenaga kesehatan di puskesmas. Ada 6 kapasitas intrinsik yang dinilai, yaitu penurunan kognitif, gangguan mobilitas, dan juga malnutrisi. Kemudian gangguan penglihatan, gangguan pendengaran, dan juga gejala depresi yang tentunya kalau ada harus dilakukan tindakan lanjut daripada hasil screening tersebut. Nah, screening dilakukan dan juga intervensi daripada hasil screening itu harus dilakukan. Apakah itu akan berupa rujukan, apakah itu berupa konseling dan juga pelayanan. Kemudian slide berikutnya adalah berbagai pedoman-pedoman atau petunjuk-petunjuk teknis yang memang sudah kami bangun bersama seluruh organisasi profesi, para guru besar dan juga para akademisi, penerima manfaat, juga dengan swasta, juga dengan mitra yang berkait dengan lansia, kemudian juga tentunya dengan petugas-petugas puskesmas yang ada. Untuk pedoman ini, karena tadi undang-undang mengatakan mendahulukan bagaimana peran dari keluarga. Tentu keluarga sebagai caregiver informal itu harus diberi pengetahuan, diberikan pendidikan atau literasi untuk mereka bisa melakukan pendampingan pada lansia. Apalagi kalau lansianya adalah harus mendapatkan perawatan jangka panjang yang punya dependensi yang tinggi gitu ya. Kemudian karena tadi survei kan mengatakan juga bahwa 72,8% bahwa lansia itu sebenarnya pengennya dirawat oleh keluarga sendiri. Dan pada kenyataannya memang di Indonesia ternyata caregiver itu sebagai pendamping lansia itu di Indonesia adalah keluarga. Ada 62,9%. Jadi memang sangat perlu memberikan pemahaman yang utuh terkait pendampingan ini kepada keluarga, apalagi kalau pendampingnya adalah yang bukan keluarga sendiri. Jadi ini juga sudah diberikan secara online, masif online course, open courses itu untuk semua orang bisa mengakses. Semua orang bisa mengakses dengan mudah, dengan sesuai dengan waktunya masing-masing. Nah, ini mungkin slide berikutnya mungkin ini 2 terakhir. Implementasi dari transformasi sistem kesehatan yang salah satunya adalah pilar transformasi pelayanan primer. Bahwa implementasi dari transformasi pelayanan primer adalah integrasi layanan kesehatan di primer tersebut. Integrasi kesehatan fisik dan mentalnya, integrasi programnya, dan integrasi juga SDM-nya, sumber daya manusianya. Dan untuk mewujudkan itu semua, struktur layanan kesehatan primernya harus ditata ulang dulu. Ditata ulang di mana puskesmas itu ada di tingkat kecamatan. Puskesmas pembantu ada di level kelurahan atau desa. Kemudian ada posyandu, pos pelayanan terpadu itu ada di level RW atau RT. Ini di istilah di Indonesia ya. Kemudian kenapa? Agar semua masyarakat Indonesia termasuk lansia bisa terlayani semuanya karena fasilitasnya sudah mendekatkan ke sasarannya, ke masyarakat, ke rumah, ke keluarga. Karena di desa, di RT, di RW ada namanya kader yang sudah punya kompetensi untuk melakukan kunjungan rumah. Dan mereka sudah diberikan pemahaman kompetensi, 25 kompetensi di dalamnya termasuk untuk melakukan kunjungan rumah dengan melaksanakan screening pada waktu kunjungan rumah, kemudian memantau minum obat dan sebagainya tentunya. Nah, pelayanan lansia ini bisa dilakukan di semua jenjang layanan yang tadi kami sampaikan. ke posyandu, kemudian berjenjang ke pustu, puskesmas pembantu, kemudian berjenjang sampai ke puskesmas, dan referralnya itu tentu akan berjenjang. Ketika tidak bisa dilayani di posyandu, tentunya harus dirujuk ke puskesmas pembantu, kemudian nanti dirujuk kepada puskesmas, dan ketika bukan kompetensi dari puskesmas, nanti akan dilakukan rujukan ke rumah sakit. Nah, berikutnya adalah di dalam integrasi slide-nya. Integrasi ini nanti akan dilakukan piloting. Nah, ini piloting yang memang ada adjustment waktu sebenarnya ya. Jadi tolong jangan dilihat waktunya ya. Ini karena dari plan-nya memang sudah mundur karena ada sesuatu yang memang harus kita sesuaikan. Jadi di dalam integrasi layanan tadi primer itu kita akan lakukan piloting dulu. Walau saat ini sudah berjalan sebagaimana separated dan masih belum terstandar dengan baik gitu, tapi tahun ini akan kita piloting, kemudian akan kita scale up di tahun mendatang. Dan saat ini juga sedang dilakukan kajian bagaimana mengintegrasikan layanan lansia ini juga dengan layanan lansia terintegrasi yang sedang dibangun oleh host hari ini adalah dengan Bappenas, yang besok kita juga akan turun ke lapangan untuk melakukan kunjungan lapangan ya. Nanti bagaimana integrasinya ini, integrasi layanan primer untuk lansia dengan juga integrasi layanan lansia terintegrasi dengan yang Bappenas. Nah, harapannya kita ini bisa berhasil sehingga pelayanan lansia di Indonesia tentunya akan semakin baik dan terintegrasi, pelayanannya mudah didapatkan, waktunya pelayanan tidak makan waktu yang lama, seorang lansia tidak menunggu lama untuk pelayanan dan tentunya berkualitas dan semua lansia bisa terlayani. Ini slide kami yang terakhir. Dan sebagai kesimpulan tentunya bahwa peningkatan jumlah lansia mempunyai potensi masalah kesehatan. Di antaranya adanya penurunan tingkat kemandirian, kebutuhan pendampingan lansia atau caregiver, masalah pembiayaan dan juga untuk kesehatan lansia dan perawatan jangka panjang bagi lansia yang membutuhkan PJP. Kemudian pentingnya dukungan dari semua pihak, lintas program, lintas sektor terkait dengan dalam meningkatkan kesehatan lansia dan disabilitas. Kemudian lansia tentu perlu didorong untuk memiliki jaminan kesehatan yang tentunya kita harapkan bahwa lansia bukan menjadi beban, tapi mereka juga ikut dalam pembangunan di kesehatan dan mereka bisa produktif dan juga bisa berdaya dan juga produktif. Mungkin itu yang kami sampaikan, sharing kepada Bapak Ibu sekalian. Terima kasih. Saya kembalikan ke moderator.
Thank you very much, Dr. Vencia. That was a rapid move, a deep dive through the transformation taking place here, but especially from the perspective of the health sector and the transformation of the primary care system and the role that it can play in supporting the integration of services. And again, she raised the issue of building off of the capabilities and assets of the existing system with a strong focus on the life cycle approach and a strong focus also on expanded capacity building. So we're just a few minutes from the end, but I wanted to really have time to open up to the audience in case you have any questions. We could take 2 or 3 quick questions for the presenters. You have here really the full spectrum to be thinking about in the development of long-term care services. I think there's some people in the audience to help to take around the microphones. Any hands out there? It's the gentleman in the middle, right there. Are there any other hands I missed? Okay. Please go ahead.
Thank you very much. This is Mohammad Sarwar Hussain from Bangladesh. I am acting as a Joint Secretary, Ministry of Social Welfare. you know, as a Ministry of Social Welfare, we have to deal with such type of things. But in Bangladesh, if we compare, here the approach is somehow different. Because for the disabled, there is another program in Bangladesh. But last presenter present that disabled and other should be come over there, then it should be scrutinized and they will refer to the concerned sector or concerned department who is very disabled or something like that. But our very heading means that we should approach for a group who need long-term care, not medical care. Just so, I think this is a mixed approach. There should have some person who has disability, even some other problem who need very, very medical care also. But our focus here just who need long-term care, not for medical purpose. So in Bangladesh, we have disability for another department. They have given medical care, their medical assistant device or something like that. Anyway, thank you very much for your presentation, but it should be clear-cut, a difference and a very, very concrete decision, whether we should go for the person who need long-term care only, not medical or other helps. Okay, thank you.
Thank you. Anybody else? Okay, over there. Excuse me.
Thank you. And nice to hear about the integration and also with the primary health care, strengthening primary health care. What I would suggest is, it's from our personal experience from our city, that long-term care has got very good connection with primary health care too. Because early you detect issues in primary health care, the cost is also less. Health economics works well. Because for example, you detect a diabetic retinopathy right early, maybe a year or two prior to the symptoms that come in. Before a person comes with blurred vision, you try to understand there is a retinopathy going on, then your health economics also works. So it's more cheaper to have good technology, AI-based technology in the primary health care, and it's much, much cheaper than we expect. Because the healthcare, the HR cost is also less when it comes to AI-based thing. So we have to seriously think about bringing in technology to grassroots, technology to the primary healthcare, and not limiting getting the best of the technology in the tertiary healthcare, which actually proves good. So it's only a food for thought. Thank you.
Thank you very much. It's an important statement on the role of technology.
Yeah.
There's one more question.
Yeah.
Yes.
Imtiaz from Helpage India. So as Kathleen mentioned, we've kind of piloted few of the experiments on volunteer-based home care. In India, we're trying to scale it up.
Sorry, could you speak a little closer to the mic?
Yeah, is it audible? Yeah. So as Kathleen mentioned, we've done a few experiments in home care in India, and we've taken it forward to other locations. It's an ongoing experience and experiment that is happening. Some good policy level traction is also there in terms of it figuring in the National Action Plan for Senior Citizen by Ministry of Social Justice and Empowerment. There's a bit of traction in the National Program for Healthcare of Elderly. But my broader question is, CSO will continue to work in LTC, do these experiments and data-driven and evidence-based approach, and try to present those. Governments will formulate policies and try to expand it. But there is this genre of silver economy and private player who are coming into the elderly care sector because there is a growing market and need for market-driven services to be provided to the elderly, those who can afford it. So my question to all the panelists is, how do they, from their experience, see the issue of equity and equality coming up in such a care, and what could government and other stakeholders do to ensure that? Because market-driven economy is again open to demand, supply, and profitability game. How do we make a sense out of it so that going ahead, long-term care is equitable and also equal for everyone? Thank you.
Thank you. Caitlin, you're nodding your head like you could hear well, so.
Well, I think for Imtiaz's question, it might be Nakamura that would be a great person to respond, but he was asking about, with all these private, for-profit and non-for-profit providers, how do you actually do anything to ensure quality across and between them? And I think there's probably something to say about that from, am I right that you would, do you have a comment on quality and how you ensure quality across?
Okay. Thank you very much for asking about ensuring the quality. In case of Japan, under the long-term care insurance, the quality of the services are mainly ensured through the pricing and payment terms. So there are certain, so pricing and the payment terms are made by the government, the central government. So they can, they set their appropriate prices so that they are private, including for-profit and not-for-profit entities can operate continuously. And also, if the service providers would provide services with more higher qualified staff, maybe the pricing would be a little bit higher than the other services. So that kind of the mechanism is set in long-term care insurance in Japan.
Thank you. While quality is an important question, I was also very interested to understand equality and equity in terms of the services getting to lower socioeconomic group, those who may not be able to afford it. Where does it all lie? Because if the prices increases, it becomes very difficult for low socioeconomic people to afford it. Well, quality is also one of the things that to be discussed on the table.
Okay, so let me respond to the question of the equality. In Japan, we have a kind of the public system to cover all living in Japan, aged 65 and over, regardless of their income level. So basically, their users have to pay the 10% of their set price. But there are some mechanism to reduce their cost for their people with lower income, and also if you are under the public assistance system, they don't have to pay the user fee. And in terms of the equity, there are several levels of the premium. So if your income is low, you pay the lower level of the premium, and if your income is high, you pay the higher amount of the premiums. So.
Thank you very much. So we've come to the end of our time. I'm sorry, I still see a few questions, but maybe you can come and ask the presenters afterwards. This session has tried to present the deep dives of a couple of countries which are rapidly transforming and very quickly developing their long-term care systems, but also their national strategies and approaches going forward, and you can see the kind of evolution that's happening. And then I think we also heard a great deal about the range of core stakeholders and the importance of considering them as a part of the ecosystem. And finally, some of the key comments that Mr. Nakamura made about building from the available assets and capabilities. But I think that last question brought to consideration some of the other very important points to consider, which is ensuring quality of services and also affordability and addressing issues of inequity. So thank you very much for joining this. A big round of applause for all of the presenters. And close of the session.